Prior to administering general anesthesia as a practitioner, there are a few important steps that shouldn't be overlooked. Getting a full history from the owner is very important, as it may highlight some key points that may affect the anesthetic event. So, for example, what is the animal's temperament? If the dog or cat is extremely anxious and not friendly when they go to the vet, you may need to consider a little bit of a heavier pre-med combination compared to that happy-go-lucky lab who wants to give you kisses. Next is, is the animal on any current chronic or current medication? This is an important thing to know because some medications may predispose the animal to hypotension under anesthesia, and some of those examples are ACE inhibitors for heart disease. So those are important things to know and to plan on. Another example is, when did the animal last eat? So it is recommended to guide those owners for elective procedures to, not feed them the morning of surgery. Right now, we think it's about 6 hours we should fast animals to help reduce the risk of regurgitation and aspiration. So it's always good to ask kind of in the morning, like, hey, are we sure we didn't feed him breakfast this morning? If not, we should probably wait a little bit longer just to reduce that risk. You can't always do that. If it's an emergency situation, you have to move forward. But, for elective cases, it's a big thing that you can do to reduce risk. Next is to perform your own thorough physical exam. So there's been many times that I've seen someone hear a heart murmur when 2 previous people, and lots of factors could have contributed to this. Maybe, it was really loud in the exam room when that first practitioner was listening, or the animal was heavily panting because it was anxious, or it actually did develop a heart murmur after being hospitalized for a few days on fluids or something like that. So it's very important to, one, do a physical exam every day on your patients while they're in hospital, just to key in on changes, but also to make sure nothing has developed and that could change your diagnostic or anesthetic plan for that patient. Lastly is blood work. So for young animals, healthy young animals getting an elective procedure, usually we, just do a PCV, total solids and a glucose. That seems to be more than sufficient according to the literature. But any patient that is sick or is on the older side, it is highly recommended to run a full CBC and chemistry to look at their systemic health prior to anesthesia to make sure, we're not missing anything or we need to do something special for them. Additionally, I think being aware and making your clients aware of anesthetic risks is very important prior to anesthetizing any patients.